Hello everyone, welcome to LUMP's special lecture series featuring ear seed acupressure and auricular therapy. Day 4 of 4. Standardized ear treatment for geriatric patients. 7-point formula. Modify according to patient signs and symptoms if necessary. Add points for specific conditions or localized areas of the pain, like the knees, low back, shoulder. Shenmen quiets the heart, calms the spirit, puts the patient into a state of receptivity for the treatment, treats restlessness, insomnia, mental disorders, sometimes characteristic of old age. Shenmen neutralizes toxins from prescription drugs, cures inflammation for arthritis in elderly. Many geriatric diseases have pain component. Shenmen is one of most clinically effective points for pain because this point pertains to the heart and, as an aging says, when the heart is serene, all pain is negligible. Brain. Regulates neurological function and benefits the mind. Regulates excitation or inhibition of cerebral cortex, general treatment point for diseases of nervous, digestive, endocrine, urogenital systems. Treats neuropsychiatric disorders, insomnia, prolapse. All of the above problems are common in the elderly. The brain controls everything. 3. Sympathetic. Any of 3 locations. Relieves pain, so it is a useful point if the elderly patient has pain. Stimulates dilation of blood vessels, therefore improving circulation, lack of circulation being a leading cause of illness in the elderly. Treats ophthalmological diseases common in elderly. Number 4 is kidney. Tonifies the root chi of the body, foundation, yin and yang, which declines with aging. 5 and 6, spleen and stomach. Treating the spleen and stomach reinforces postnatal chi, which may be weak in elderly due to age or poor nutrition. Treating these points builds blood. Since spleen dominates the muscles, it is good for treating muscular atrophy and muscle weakness due to lack of exercise and age. 7. Liver. Liver promotes free-flowingness of the chi, thereby maintaining harmonious relationship between internal organs and external environments. Moves blood, moves stagnation, builds blood and yin, increases energy. Liver is good for blood disorders like blood deficiency, stagnation, yin deficiency. These are common in the aged. Modalities and contraindications. The elderly can benefit from auriculotherapy because the auricular treatment with pellets is gentle and effective. As always, provide written instructions to enhance patient compliance. Do not prescribe home therapy if the patient's mental state, physical capabilities, or living situation interfere with the patient's ability to follow the instructions. In general, gold pellets are used to tonify the deficiency. Standardized oncology formula for the side effects of cancer treatment. So we have an 8-point formula. Use as follows, or add or delete points based on signs and symptoms or specific areas of the body affected. Shenmen. Common sequelae to radiation and chemotherapy treatments are anxiety, palpitations, weakness, pain, restlessness. Shenmen is useful for these discomforting feelings because it neutralizes toxins and reduces inflammation, which are also side effects of Western cancer therapy. Brain, or subcortex. Brain point is used to treat the symptoms of Western cancer treatment: fatigue, anxiety, swelling, shock, pain perception, insomnia, inflammation. Number 3, sympathetic. Pain is a symptom of cancer treatment therapies, especially radiation. Sympathetic is effective in reducing pain. 4. The lung, upper and lower. As master of qi, lung points increase energy, strengthen wei qi functioning, improve respiration and oxygenation by sending energy to kidneys. Oncology patients report range of tiredness from fatigue to exhaustion as major complaint. Lung points move the liver because metal controls the wood and thus assist in pain relief. Lungs relieve depression common in patients with cancer. Lung points aid in treating skin problems due to decreased wound healing capacity and relieve dry and irritated skin. Lung points are helpful in treating burns that result from radiation therapy. Liver. Liver promotes free-flowingness of qi, maintains internal patency of qi, regulates relationship between patients' internal and external environments. Liver moves qi and blood, which may be stagnant, and balances emotions. Because cancer is such a devastating illness, patients' emotions are highly involved in the illness versus emotional component of having a common cold. Liver builds yin and blood. Radiation patients develop yin deficiency and chemotherapy patients develop qi and blood deficiency. Kidney tonifies through qi of the body, basis of immunity, builds blood and yin. Kidney point assists in hair regrowth and increases libido. Cancer patients undergoing traditional Western therapy suffer from both hair loss and decreased libido. 7 and 8, spleen and stomach, reinforce the qi of middle jiao, therefore helpful in treating nausea and vomiting, aid digestion, improve appetite. Spleen and stomach reduce dump or phlegm, thereby regulating thirst and abdominal distension. They control blood and blood vessels and promote building of blood, which is necessary and inevitably damaged along with cancerous cells from Western cancer therapies. Spleen and stomach ground the patient and strengthen the muscles, which are controlled by the earth element. These points can be used as a 5-element couple or separately based upon predominant symptoms. Modalities and contraindications. Pellets are more effective for cancer patients. Pellets are easy to use, provide continuous therapy at home, reduce the need for repeated needling, which is contraindicated for weakened patients. Patients must have the pellets removed at the appropriate time in order to minimize chance of infection. Remember, cancer patients have reduced wound healing capacity. In general, gold pellets are used to tonify the deficiency. Standardized pain formula. We use a 7-point formula for all types of pain. Add other points according to the location of the pain: shoulder, knee, low back, ovaries, and according to other signs and symptoms. Shenmen. Pain in Oriental medicine is due to stagnation. Many factors can lead to this stagnation: heat, cold, blood deficiency. Heart, according to Zhang Fu theory, governs blood and is responsible for its movement. Qi follows the blood. Thus, stagnation and its clinical manifestation of pain can be treated through the use of Shenmen, analogous to treating the heart. Brain point regulates all body systems, thereby reducing pain, shock, inflammation that are characteristics of pain. The brain is the critical mediator in pain. Sympathetic stimulates dilation of blood vessels, thereby reducing swelling, congestion, inflammation, common characteristics of pain. Diaphragm, or point zero, is the major point for treating qi and blood stagnation that lead to pain. Assists breathing. This moves qi of lungs and liver by way of the control cycle. Use of diaphragm point is equivalent to opening the Di channel, a channel regulating qi and blood flow throughout the entire body by way of the 3 jiaos. Use diaphragm point to promote homeostasis and redirect blood back to its proper pathway. Adrenal point is used for pain, shock, inflammation. It regulates hormones involved in pain manifestation. Liver promotes free-flowingness of qi, thereby regulating the blood. Lack of such patency produces pain. Relaxed muscle is a special point within the liver area that addresses muscular component of pain by relaxing muscles. Modalities and contraindications. Perform ear needle treatment in the office to activate flow of qi and blood and to reduce pain. Tonify or sedate based upon characteristics of the pain, that is, whether coming from excess or deficiency. Do ear pellet treatment in the opposite ear for treatment at home. Retain take-home treatment for 3 to 5 days and have the patient press on the pellet 3 to 5 times a day for 3 to 5 seconds. If the patient is needle sensitive, only needle the sympathetic point or the point that you think might bring the greatest relief, or simply use pellets. If patient's complaint is due to a disorder that requires surgery, explain to the patient that the ear modality is being used for pain management until surgery and has not been provided to mask the pain or to replace surgery. If pain is in the chest or heart and there is a phlegm component, do not use Shenmen. Use gold or silver pellets based upon differentiation of the pain. Standardized immunity treatment. An 8-point formula. This is an effective formula for immune disorders. Add or delete points based upon signs and symptoms if needed. In the treatment of immunity, Shenmen is an important point to balance and settle the patient, as patients with immune disorders are sensitive and delicate and frequently experience musculoskeletal pain. Brain point enhances the functioning of the entire body, which is needed in immune problems. Use of sympathetic point in the treatment of immunity is to improve overall functioning and to reduce pain that accompanies immune disorders like fibromyalgia, lupus erythematosus. Lung points assist in treatment of immunity by improving respiration, that is, oxygenation to the body, help in emotional components of immune disorders by moving qi, thereby reducing depression. Patients with immune disorders have systemic qi deficiencies. Lungs, as master of qi, control the qi of the entire body. Liver point builds yin and blood. Patients with weak immunity have blood and yin deficiencies. Kidney is used to tonify the root qi, the basis of immunity. Spleen and stomach points stimulate the respective organs to produce qi, blood, and yin, which are deficient in immune patients. Ear acupuncture formula for terminally ill patients. To quiet the heart, ground the patient, put the patient into state of receptivity for treatment to evoke calmness in the face of such illness. The spirit must always be treated first in order to ground it. Brain controls everything and affects the mind. Heart is supreme controller, regulates the blood. Blood must always be regulated since the blood anchors the spirit. Heart reinforces Shenmen. Liver promotes patency of liver qi to harmonize bodily energy. Kidney supports natural qi cycle of growth, development, decline. Spleen and stomach balance, ground, adjust muscles because of 5-element correspondences. Sun jiao is an alternate point, harmonizes the 3 jiaos of the body. Use gold pellets or gentle ear massage. Miscellaneous formulae. We have standardized respiratory formula. Shenmen, as long as no phlegm. Brain and or brainstem. Upper and or lower lung. Kidney, diaphragm, dingchuan, affected areas like nose and chest. Fibrocystic breast disease. Shenmen, brain, sympathetic, liver, spleen, stomach, kidney, mammary, diaphragm. Acid reflux disease, Shenmen, brain, sympathetic, spleen, stomach, liver, cardiac sphincter, esophagus, lung, diaphragm, throat. Peripheral neuropathy, Shenmen, sympathetic, liver, brain, affected areas, that is, fingers and toes, affected spinal segment. Stop smoking, Shenmen, liver, lungs, upper and lower, kidney, mouth, stomach. Gallstones, Shenmen, liver, spleen, stomach, brain, hypertension groove, sympathetic, vagus. Myopia, Shenmen, occiput, liver, spleen, stomach, heart, kidney, lung, eye, I1 and I2. Stop smoking, we have 3 different formulae. A. Shenmen, upper and lower lung, brain, adrenal. B. Shenmen, mouth, spleen, stomach, adrenal, upper or lower lung. And letter C. Endocrine, adrenal, hunger. Infection, outer ear, in the helix, adrenal, occiput, kidney. Breast disorders, fibrocystic breasts or breast distension, mammary, stomach, endocrine. Insomnia, Shenmen, heart, kidney, brain. Hiccup, diaphragm or point zero. Gastralgia, Shenmen, stomach, duodenum, abdomen. Leukorrhea, endocrine, kidney, ovary. Headache, Shenmen, brain. Weight loss, we have 3 different formulae. Formula A, Shenmen, stomach, lower lung, hunger. Formula B, Shenmen, endocrine. Formula C, stomach, brain, hunger, thirst. The National Acupuncture Detoxification Association, or NADA, ear acupuncture protocol has been employed to treat addictions. A perusal of the energetics of those points, Shenmen, sympathetic, lung, liver, kidney, can be useful in understanding how each point contributes to the clinical outcome. The NADA protocol is a nonverbal approach to healing that involves the gentle placement of up to 5 small sterilized disposable needles into specific sites on each ear. Recipients sit quietly in a group setting for 30 to 45 minutes, allowing the treatment to take effect. The NADA protocol is an adjunct therapy. For more details about the protocol, contact NADA Philippines President, Ms. Janet Paredes. Pathology of drug abuse. Addictive drugs used abusively consume yin and jing. As a result, withdrawal symptoms can be viewed as yin deficiency. Excess sweat, anxiety, and insomnia are heart pathologies treated through Shenmen. Anger, irritability, euphoria are the result of liver pathology. Diarrhea and loss of appetite are spleen problems. Paranoia, kidney symptom. Sympathetic point to dilate blood vessels, reduce pain of withdrawal, balance sympathetic and parasympathetic branches of autonomic nervous system. Kidney is the main point to strengthen Jing and foundation Yin in the body. The NADA formula tonifies Yin of the lung, liver, heart, and kidney. Lung point has the greatest connection to vagus nerve, thus blocking dopamine uptake. Dopamine, chemical in the brain, mediates pleasure. Several addictive drugs stimulate dopamine release, and others, like cocaine and amphetamines, inhibit it, and by doing so, dopamine molecules come out of storage, thus increasing pleasure and addiction. Ear acupuncture interferes with this uptake. Lower lung point assists in grieving and letting go of the addiction or underlying problems. Anxiety is persistent feeling of dread, apprehension, or impending disaster and uneasiness. In a study on reducing the symptoms of drug withdrawal in prisoners, patients in the sham and NADA groups reported reduced symptoms of discomfort and improved nighttime sleep. In time, the sham effect was reduced. Treating anxiety in an ambulance with ear acupuncture on relaxation point, hypertension point in the triangular fossa, helped reduce anxiety on the way to the hospital. Bodies Shen Kong and Shenmen did more in reducing anxiety, tension, calming, slowing down the heart rate, activating parasympathetic nerves, slowing activity of the cerebral cortex. Good points for treatment of anxiety. Auricular acupuncture for dental anxiety reduced prolonged sedation. Both auricular and body acupuncture were effective in treatment of preoperative anxiety. Shenmen is point of choice for preoperative anxiety. Maternal anxiety was decreased during pre-op period for children undergoing anesthesia. This is useful because there is correlation with increasing child's anxiety when it is present in the mother. Auricular acupuncture is useful for athletes. In a study on boxers, it had the effect of slowing the heart rate, reducing oxygen consumption, increasing lactic acid removal, decreasing warm-up time. Combination of auricular and body acupuncture for analgesia in lithotripsy made patients less anxious before surgery and reduced the analgesic requirement before the procedure. This is very useful because in some normal analgesic procedures, certain drugs actually make the patient more anxious. Vomiting induced by chemotherapy can be reduced with auricular acupuncture, especially if pericardium 6 is first treated. Pain caused by tumor invasion, surgery, chemotherapy, and radiation can be treated with auricular therapy, thus contributing to quality of life. In this case, auricular therapy seems to act differently than the body acupuncture. There are types of pain that do not respond well to drug treatment. Acupuncture relies on two hypotheses: that there are specific points that should be treated for a given patient with given symptoms with auricular therapy in decreasing neuropathic pain in cancer patients, and that the insertion of the needles at these points alleviates the symptoms. Congenital nystagmus is involuntary rhythmic eye movement that also affects visual acuity. Nystagmus was decreased and visual acuity improved. Oculomotor points include eye proper, the center of the lobe, along with the clinically effective points I1 and I2. Ocular myasthenia was also improved with the eye points and Shenmen. To reduce blood sugar levels, we use pancreas, thalamus or brain, lower blood pressure point or hypertension point. Pancreas point is also known as the diabetes point. Ear acupuncture suppresses epileptic seizures via the parasympathetic system because the external ear have parasympathetic innervations. Epilepsy is characterized by increased sympathetic activity and decreased parasympathetic action. High sympathetic function leads to death and heart failure. Some epilepsy is resistant to drugs and leads to depression. The use of ear points is valuable. Auriculotherapy using Shenmen, lung, forehead, hip is a complementary analgesic method for hip pain. It also reduces drug requirements, reduces preoperative anxiety, anesthetic requirement, post-surgical pain. In a review of the frequency of insomnia in women, the following points had the listed success rate: Shenmen 100%, heart 83%, occiput 67%, subcortex 50%, brain and kidney 33%, liver, spleen, endocrine, sympathetic each 16%. In the first study on the knee, relief of pain from knee surgery was 70% with the points Shenmen, knee, lung for vagus nerve control. The ear acupuncture group required less ibuprofen after surgery. 60 to 90% of adult population will suffer from low back pain at some point in their lives. Pain relief was obtained with auricular acupuncture and electrostimulation. It is important for patients with musculoskeletal problems to move the affected area when the auriculotherapy is applied. Another article stressed that the electroacupuncture is more effective than conventional ear acupuncture for chronic low back pain. Continuous stimulation at home with a disposable electrical device augments treatment. Auricular pressure was used in patients in peri and early menopause. Shenmen and subcortex, or brain points, were used bilaterally, resulting in decreased need for medication. Using auricular acupuncture promoted a feeling of satiation for obese patients. Points were treated bilaterally. Lipid metabolism was enhanced and intradermals were used. Auricular acupuncture can be used as a complementary modality along with other behavioral treatments. Post-operative agitation in elderly patients can be a problem if their agitation leads to injury, hemorrhage, removal of tubes and catheters. In such cases, restraints are commonly applied. In patients with a history of prior agitation, tranquilizing points are useful. In this study, point 0, or the diaphragm point, applied bilaterally, promoted homeostasis and supported the action of other points used. Posttraumatic stress studies arose directly out of the 9/11 terrorist attacks. Nadotherapists noted that ear needling confers improved hope, and that hope may be more important than previously expected in PTSD patients. Subthreshold PTSD leads to increased risks of suicide, so the ear can treat anxiety before progressing further. A strength of ear acupuncture is its nonverbal ability to promote relaxation and trust. Later, after acupuncture, people can consider verbal counseling. Transference was avoided as well. Pregnant women suffering from low back pain and posterior pelvic pain received continuous auriculotherapy for 1 week with press needles in the last trimester of their pregnancy. Since there is no safety data using auricular press needles continuously on pregnant women, the researchers decided from clinical experience that 1 week was safe in the last trimester to treat back pain. Electrical acupuncture therapy for patients with spinal cord injuries at unspecified points on the anti-helix, helix, and lower portion of the back of the ear in the emergency room or soon after spinal intervention, along with electroacupuncture to body points, SI3 and bladder 62, contributed to significant neurologic and functional recoveries when implemented early in acute spinal cord injury. In a first-of-its-kind study, auricular acupuncture was found effective in reducing vomiting, including dry retching, following transabdominal hysterectomy in female patients. Pericardium 6 was helpful as adjunct point in the recovery room when electroacupuncture was applied. Interestingly, the point was not useful with laparoscopic hysterectomy. Points used: Shenmen, Sympathetic, Stomach, Occiput. Patients reported post-operative nausea and vomiting following cholecystectomy as more of a concern than the post-operative pain. The following points reduced the vomiting by 100% in the acupuncture group 24 hours after surgery: Shenmen, Sympathetic, Stomach, Occiput. PONV is the leading cause of readmission to hospitals with a rate of 53 to 72%. Intraoperative hypotension causing brainstem hypoxia leads to vomiting, and intestinal tissue is active metabolically and has poor intolerance for hypoxia. Serotonin is released, which is a highly emetogenic substance, that is, it induces vomiting. Administer acupuncture in the recovery room. Thank you very much for your attention.